Good evening, doctors. Just give us few more minutes to will starting this live telecast, and also parallelly it is running through YouTube and also it is running through our Zoom platform. Give us few more minutes as we are expecting more doctors to log in for the in the next few minutes. So once that is done, we will be initiating this session. Thank you. A very good evening, doctors. A warm welcome from Micro Carcian 1, the pioneer division of Microlabs. Today, we are proud to initiate the second edition of our Telplus Treats webinar program, and it is a very unique initiative. The reason is we are talking beyond medical. Here, we are highlighting something which is we need today in today's life scenario. Very important session, as this is going to be the second edition of this cybersecurity webinar program. Today, we are proud to introduce the second edition, and it is called as Cyber Patient Data Security. So, as we move forward on this, Doctor, I would happy to share with you the most important aspect. We Microlabs Limited, we have already completed our golden jubilee. That is, we are into 51st year of since our inception. We are an organization, Microlabs. We established in the year 1973. We are having the coverage right from entire pharmaceutical value chain from research to development, including API, finished formulation, and marketing distribution, India and also globally. We are the top 20 companies in the world. We have 22 specialty division, which covers almost all therapies there to take care of with world-class quality products. When I talk about the doctor world-class quality, 14 world-class manufacturing facilities we do have, which has been approved by US FDA, UK MHRA, and you name that, those facilities are there with us. That's a proud scenario for us in terms of we are a quality house. We have a vibrant presence in over 50 countries, exporting formulation and active pharmaceutical ingredient in all major therapeutic segments. We have a full-fledged 3 R&D centers, which has been manned by 400 experienced scientists. We have a GDA Foundation, which runs our Surana College and Surana PG centers in Bangalore. We have a charitable trust, which runs Sushildam, our own temple, and also a magnificent Jain temples. 2 of them are present in Bangalore, Atibale. With this, I have the privilege on talking about the second edition of this digital safety essential for doctors. And this time we are talking about earlier in our program, we covered in our volume 1 with your excellent response from all of you. We had a program, first webinar, which spoke about cybersecurity fundamentals for doctor, especially when I use a mobile device, my email and social media, how I can handle them safely, all those things. Now, today, we are going to talk something related, very much relevant towards you, that is patient data security. So this is going to be the thing. And we would going to have the third session in the month of June, that is 15th June, doctors. that is Internet of Medical Things. Normally, everybody knows Internet of Things, that is IoT. Now there is a new term called Internet of Medical Things for the connected devices. With that, I have the privilege, and this the expert here doesn't need much introduction. The reason being, you have already attended to his extraordinary state-of-the-art communication when it comes to cybersecurity. Here, I have privilege to introduce Dr. Anand Prabhu, who is basically a professor in computer engineering, cybersecurity, and cyber law trainer. The most interesting things about him is he has conducted more than 2,500 workshops across the country, and he's been a trainer for Karnataka Judicial Academy, Karnataka Police Academy, and other national academies across the country. He has got 225 plus journal articles in his name. He has already have patents, three of them been published, and he has authored many books covering almost all plateau of something related to cybersecurity and safety. His mission is Cyber Safe India. So today we have the privilege in bringing him here, and a few glimpses of events I am sharing here as photograph. You can see he has covered many things related to top police officers across the country, especially more into Karnataka. And with this, I have the privilege in bringing him here live today with the team, because through the first edition, what he took, we were mesmerized because he was able to bring in information which we felt very simple, but how much complication it brings to us on a day-to-day basis. He simplified it and explained how we should safeguard. Sir, welcome. It's a privilege that you are there for our second edition. Dr. Anand Prabhu, please take it forward. The floor is yours.
Thank you very much, Vignesh ji. It is such a privilege and honor to be here and interacting with so many doctors. And their participation here shows the prime importance that they're giving for cybersecurity, because this is one area which has not spared anybody. It has not spared the doctors, the patients, the judiciary, the police, you name them. Everybody has been a victim of cyber crimes, unfortunately. But it is with us, with all of us, to make sure that we stay safe and we stay protected from the cyber crime. So today I will be talking about various things when it comes to the attacks that can happen. But we will be restricting our today's session with the patient data security. So just give me a moment. I will be sharing my PPT so that all of us can have a look at it.
Would as Dr. Anand Prabhu is going to live cast this, I have humble request from our side to all the doctors who are attending. If there are any queries, please put those queries in the chat window. We at the end of the session, he would be the expert would be trying to explain you the way forward on many of those things. Any queries at any point of time, please type it in the chat window. Thank you.
Yes, sir. I have also kept the chat window open here so that any questions at any point in time, I will take it live as well. So today we're going to talk about various cyber crimes. But before that, as we know that the doctors have now become very much acquainted with technology, and they use technology not only for their communication but also for their diagnosis. The problem here is why cyber attacks are currently a problem in the healthcare. That is because, number one, the attack surface has increased because of digitization, the ecosystem of interconnected devices everywhere. Because as doctors, you know that whenever a patient communicates with you, the first thing that the patient does is sends you his or her medical report by WhatsApp. And I've also seen them sending medical reports of x-rays via WhatsApp. So WhatsApp and other messengers have become the new normal now for communication, without many of us knowing what are the consequences that can go wrong by sending data using such messengers. And also the growing security talent shortage. I see very few security experts in hospitals. I have, in fact, I've not seen many. Of course, I've seen system admins, but security experts, we don't see them. And you can just imagine what a catastrophe it would be if the patient data records get viral. And imagine a patient has got AIDS, okay, or a similar disease, which is kept private, which is kept secret. But because of the data leak, now the entire world gets to know that this person is suffering from this kind of a disease. The situation can be really, really dangerous. So, and also because of the ransomware and other things that the cyber criminals know that they can charge money from these healthcare professionals. So because of this, it is becoming a big problem. In 2017, the FDA had done a voluntary recall of 5 lakh pacemakers. Okay, 5 lakh. Look at the numbers. Because they knew that these pacemakers, which were implanted in the hearts of the patients, could be hacked. Just imagine somebody sits somewhere in the world and they could just log into that pacemaker and make the pacemaker stop working and the patient just dies. So this is the danger of cyber attacks in the healthcare industry. So yeah, I'm going to talk about 6 medical devices that maybe you knew or you didn't know that could be a target of cyber criminals. Number one, the drug infusion pumps, which we see in the intensive care units, are susceptible to these attacks. Pacemakers, as I've already said, wearable health devices. Okay, so we use smartwatches and other wearable devices for communication of our vitals. This can become a very soft target for cyber attacks. MRI machines. Yes, you heard it right. Because whenever MRI machine takes the scan, it is communicated to some other device, and that communication path can be hacked, and the data there can get leaked. Implantable cardioverter defibrillators and hospital networks. Now, having said this, how do these get hacked? So the most common method is phishing. So you will get one email and you will believe that this email is from a legitimate source, and then you would realize that no, you've become a victim. Second, data breach. 1.76 data breaches per day. Just imagine. Okay, so everywhere the data is breaching. Ransomware, we have discussed in the previous lecture. The DDoS attack, I'll just give you a gist of this. So DDoS, now you want to access the hospital servers because you are sitting remotely somewhere, and then the cyber criminals do a distributed attack, denial of service attack. That means everybody targets the hospital servers and the hospital server crashes. And when you are in need of the data, you have to get the data of the patient. You are unable to access the server because the server has been compromised. Insider threats, the most dangerous things. Okay, because there might be somebody in within your organization who has got access to all the data, who can make this data get leaked. And the next topic, which we'll be talking in our next webinar, the Internet of Things and the Internet of Medical Things. So these are the reasons. And the last one is supply chain. You're ordering a product from some other country. It comes via some country. And in that country, probably the hackers might just open it, implant something and send it to you. And you believe that this is an untampered product that you have received. But every data that is being sent from that will be going to the hackers. So, and we have also seen the different cyber attacks that happened where the data was breached. I gave you a gist in the previous lecture. Now, today we will be seeing how to protect this. But before that, what exactly is patient data? So, patient data can be the name, address, date of birth, medical history, medications, lab results, information regarding their insurance, etc. But I'm not going to tell you this in a very simple way. I'm going to categorically tell it to you in 4 different types. So the first one, you have to know this. It is called PII, personally identifiable information. Second one, PHI, protected health information. Third one, EHR, electronic health records. And the fourth one is genomic data. So what is PII? Name, address, phone number, email address, Aadhaar details. All this is PII. So if this data gets leaked, people would very easily identify who that person is. So personally identifiable information. Next one, Protected health information. What is this? The medical history, the lab test results, imaging scans, insurance information, billing information. All this comes under the PHI. What exactly is electronic health records? The demographic data, clinical notes, the medication and the allergy list, immunization status. Now, we had seen last time a lot of people's, their immunization data regarding their vaccination was leaked, was breached. How? So this amounts to EHR, which is the electronic health records, and then you have the laboratory and the radiology results. And finally, the genomic data. What is this? The genetic test results, family health history, genomic sequencing data. So now, doctors, you know what are the different types of patient information you have. Now, this has to be categorized as PII, PHI, EHR, and the genomic data. Now, why is the data important? Because if the data is breached, the hackers will very easily contact the patient. Simple. Look at this. Now, if the data of the laboratory is leaked, the person who had come for the lab test will get this message. Now, what is this message? Dear user, your laboratory test results are ready. Click on the link below. Now, the person believes that this has actually come from the laboratory because that morning the person had gone for lab test. Now, what will happen when the person clicks on that link? There is one attack, my dear doctors. It is called as drive-by downloads. I repeat, drive-by downloads. Simply by clicking on the link, you don't have to do anything. By clicking on the link, one malware gets installed on your device, which can switch on your front and back cameras without your knowledge. And I'm pretty sure that you, as well as your family members, most of you, I should say, I cannot generalize, but most of you have this habit of taking your phones to the bedrooms. You take your phones to the bathrooms. You take it to your changing rooms. And the best part about the phones is no matter you keep it this way or the other way, the camera is always on the top. And what would happen if your cameras are switched on, if the patient's cameras are switched on and the data from the camera, the photos, the videos are leaked? Imagine the catastrophe that can happen. So therefore, the data breaches are very dangerous. Second, privacy violation. Imagine a patient is suffering from a very terminal disease and he doesn't want that to be known by everybody else. Now, what will happen if the data is breached? The whole city, his entire family, all his friends, everybody would get to know that this person is suffering from ABC. And the misuse of data, of course. So that is the reason patient data security is important. Now, how do these get hacked? One, simple, your system gets compromised, called hacking. Second, your system is compromised with a malware, and because of that, third one is phishing, and the fourth one is insider threat. Now, how to protect your patient data is what we need to see today, because this is very, very important. I'm going to tell you step by step what are the things that you will have to do to protect it. Because now you may say, what will happen if the data breach is no big deal? Of course, it's a big deal, because in our country, there is something now called as the Digital Personal Data Protection Act. I repeat, it's called DPDP, which has come into force, and very soon it will be made mandatory for all the healthcare professionals as well as everybody. I have seen a lot of acts in our country, lot of them, and the maximum penalty that they impose on somebody is nearly 10 lakh rupees, isn't it so? But this is the first act that I've seen in my life in India where for breach, for the data breach, for different instances, the penalty crores. Yes, you heard it right. 250 crores. So that shows the seriousness that the government of India has taken in order to ensure that the data does not get breached. So you have to also make sure that the data doesn't get breached, because of the carelessness from your end, or because you have not taken the requisite measures, then the problem can happen. Now, what are the other countries following? US of A is following HIPAA. So HIPAA, you must have heard of. So HIPAA is in the US of A. The Europe follows GDPR, General Data Protection Regulation. The Canada has PIPEDA, Australia has Privacy Act, and the Japan also has one more act called APPI. Now, our country, India, has got DPDP, that is Digital Personal Data Protection Act. You cannot say, no, I didn't know that this is there. You should know. This has come 2019 onwards. This was happening, and very recently, this has come into force. Now, as per the DPDP, you need to know who the data fiduciaries are, who the data principals are, what are the different types of data, what are the compliances that we need to take. So I'm going to talk to you all about this very, very categorically. Okay. So simple example, you get a phone, somebody has gifted it to you, you take that phone and you do not know that this phone has been infected with Moco Spy. Now, what does Moco Spy do? Every data that is there in your phone, one copy goes to the guy who has installed Moco Spy. Whatever you're doing on your device, one copy goes to the person who has installed Moco Spy. Not just that, you've kept your phone somewhere, and whatever you're talking, whatever happens in the surroundings, that also the person gets to know. Now, with this, so you have stored patients' contacts, you have stored patients' lab reports, you have also stored the conversations that you have had with the patients. Now, the second, the problematic thing that could happen is you are connecting to free Wi-Fi. Doctors have this habit of going to Starbucks, going to different restaurants and connecting to the Wi-Fi network. That is the worst thing one could do. So never connect to free Wi-Fi and never connect your phone to charging cables. Now, why this charging cable? The same cable that is used to charge your phone, the same cable behaves like a data cable. So all the data that is there in your phone can just go off from one cable while you are charging your device. Now, this type of an attack is called as juice jacking. You have to charge, you have no other option. Please switch off your device and then charge it at charging stations. Otherwise, your data would be compromised and you may be charged under the DPDP. And I've also told you, you get this device called as OMG cable. Now, what can happen with OMG cable? Anybody takes that cable and connects it to your phone, the person can hack your phone in seconds. So these are the things, because my guru Sanjay Sai has always said hacking is the new normal, because out of the 100 computers, 95 computers know that they're hacked, and the rest the five do not know that they are hacked. So talking about phishing, wishing, and smishing, look at this. One message you get, and it says that your electricity connection will be disconnected, call this number. You call that number, the person asks you to install some file on your device, and again your device gets compromised. Or you get an email with a link there, you click on the link, again it gets compromised. So now, what is that compromise? Look at this. So this is the attack that is happening to a lot of people, and unfortunately many doctors have also fallen prey to that. So the attack goes this way. So you get a message, say from Canara Bank or from HDFC Bank or any of the banks, and it has a .apk file. APK file, my dear doctors, is Android package file. This method is called as side loading, wherein your device can install one app without actually going to the Play Store or the App Store. In case of Android, it is .apk. In case of iOS, that is iPhone, it is .ipa. Okay. Now, what happens here is whenever you get this file, you should never ever click on it. I repeat, never ever click on these files. Whenever you get these files, the first thing that you need to do is just delete it and block the sender. Block whoever the sender is. Even if you have got it from your boss or whoever it is, a .apk file is the most dangerous thing that can be installed on your device. The first thing, delete it. Of course, you can't block your boss, but at least delete the APK file. And if the person says install, you say, no, it is not happening. So the second thing that you need to do is to stay protected is, of course, you'll get this notification, the Achtung, the danger, the caution message that you get. What you need to do is go to your phone, go to settings, go to this option which says allow installation from apps of unknown sources. Do not check that. I repeat, do not check that. If it is checked on your device, uncheck it immediately. How? Settings, security, install from unknown sources has to be unchecked. This is for the Android users. For the iOS users, you don't have to worry if you're in India, but if the doctors here are watching this live from the Europe has allowed side loading, unfortunately, because of the GDPR. That is the most horrible thing that could be done, because side loading is one of the most reasons why the data gets compromised. So the doctors today watching from the Europe, if you receive a .ipa file, do not click on that, and please disable the unknown sources option on your iOS device. Okay, so such things keep coming where because no matter how much money we have millions, we want billions, we have billions, we want trillions. So the cyber criminals know that the only way they can lure you is by making you by telling you that your money can be doubled, tripled, and that is how they make you join some groups and make you invest in crypto, make you invest in commodities. And these apps are the main reasons where your phone can get compromised. And I told you very clearly, the best thing that you could do is install a Truecaller on your device, which will tell you whether the call is from a genuine person, if it is blue, if it is golden, the rich person, if it is purple, it is from delivery, if it is red, it is from a scammer, a cyber criminal, and if it is green, it is from a bank. Okay, so you need to understand, the next time somebody calls you and claims to be from the bank, asks you to download that .apk file, please do not do that, because that person might be a scammer who is sending you a .apk file only to capture all the data that is there. So look at this. If it is from the bank, you will see that there will be a verified tick mark. It will be green in color, and the bank name and everything would be visible. So now, coming to the data security, there are three things: confidentiality, integrity, and availability. Confidentiality means the data of the patients that you're storing remains confidential. Nobody else would get access to it. I wouldn't go to a doctor if I feel that the data that I sent to that doctor would be compromised. I do not want my data to be read or seen by anybody else but for my doctor. So the confidentiality is the most important thing that the doctor has to maintain. Number one. Number two, integrity. Make sure that the data is as it is. If my blood count is 8, the HbA count, it should not become 9 or 10 in your device. It has to remain as it is. Consistency and accuracy, integrity, because we call this as data diddling. I repeat, data diddling. So what a cyber criminal can do is, he can access the data. Somebody's blood sugar is 120, he makes it 220, just diddles with the data, and the doctor feels that, oh, Dr. Prabhu is having 220 sugar, so let's bombard him with insulin, and my dosage is increased, and I take the more dosage, and my organs fail. So this shouldn't happen. So therefore, make sure that the data consistency and accuracy is maintained. And the third is availability. Whenever you want to access my data, whenever the data needs to be accessed, you need to make sure that it is available. Now, how to make all these things possible? It is by two things: authentication, authorization. Authentication, you need to make sure that all the data is protected by passwords, biometrics, multi-factor authentication. Authorization, this is very important. See what these hospitals do. They have a computer, there is a password. Okay, now that computer has got all the data: patient data, doctor data, then old patient's data, salary data, everything is there, and one single password. Now the password will be some admin 123 or something like that. Now this password 100 people will know. Okay, the system admin will know, the receptionist will know, the doctor will know, the owner will know, everybody will know that password. Now, what will happen by that is, if somebody enters that password, he or she will get access to everything that is there in the computer. So therefore, you need to make sure role-based access, attender what he can get, doctor what he can get, chief medical officer what he can get, chairman what he can get. So we call this as role-based access control. I will tell you how to incorporate this. This is the first thing that you need to do it in your systems. Otherwise, what will happen? One single password, you share it with 10 people. All the 10 people can do whatever they want. Okay, next one, data encryption. Encryption means even if somebody hacks into your system, he or she will not get the data because the data is encrypted, similar to WhatsApp end-to-end encryption. That means the data is sent from my computer, my WhatsApp to you. The person in the middle, we call this as the man in the middle attack. The man in the middle would not get access to any of the data. We call this as what? Data encryption. So encryption at rest and encryption in transit, both encryption should be there. Then backup. Your computer calls off. If you don't have a backup, you call the patient today, send the data again, man, because I've lost the data. What a horrible thing to do. So therefore, you must have two backups, my dear doctors. One backup should be in your computer. Second backup should be in the cloud or in a storage device. This is very important because disaster can happen to anybody. And if you have lost your device, the data is gone. So if it is in the cloud, you can very easily download it. Okay, so I told you the data that you are storing, you need to remember that what we do is the crucial data, the important data that is there, what we do, we delete it. Remember, anything that is deleted can be recovered. I repeat, anything that is deleted can be recovered as long as it has not been overwritten. So what you need to do is whenever you are deleting the data that is private, confidential in nature, use this tool called Secure Eraser. So with this Secure Eraser, what you're doing, you're not just deleting, you're overwriting, which we call as erasing, which means the data that has been deleted is erased. Means anybody or everybody would never be able to get it back. So we call this as secure data disposal. How is it done? Shredding. Shredding. What to shred? The lab reports that you have. Don't simply take it and put it in the dustbin. There are a lot of people who do this dumpster diving, we call. What is dumpster diving? They love dustbins. So they go to the dustbin and they pick pen drives, they pick all the CDs and all the documents. So don't do this. What you have to do, buy a shredder. From different companies, you get 3,000, 4,000 rupees. Put those files in the shredder. It will shred through it. Degaussing. Take a powerful magnet, can keep it near your hard disk. Gone. Data can never come. Data digital wiping. Digital wiping, I've already told you, by Secure Eraser. So ensure compliance with the laws on data disposal. Second one, risk management. Hire one cybersecurity guy and find out what are the various risks that are there in your hospital or in your clinic or in your organization, and find out the strategies to mitigate them. Always be proactive and not reactive. I'm very sad to see a lot of people are reactive. Oh, attack happened. Now what to do? Why didn't you think about it earlier? So think of mitigation strategies by risk assessment. So incident response. Some incident happens. Of course, incident can happen with me also. What to do? Preparation, detection, containment. Preparation, detection, containment. And remember that your password should minimum be 16 characters with the capital letter, small letter, numbers and symbols. I repeat, capital letter, small letter, numbers and symbols, 16 characters minimum. It would take a cyber criminal 5 billion years. The number of zeros, I don't know in billions, but 5 billion years it would take one cyber criminal to crack your password. Okay, and never use pirated. So most of us, what we do, some software we want to use, some tool we want to use for making our work easier, but we are very stingy. We don't want to spend the money and buy a paid version. Never do that, because if you are using a pirated software, that will be the main reason why your data would get compromised. And employee training is one of the most important things that needs to be done. So what I have done now is I have mapped the 10 points that every doctor should remember with regard to the Digital Personal Data Protection Act. Tomorrow you should not tell I did not know. So the first thing is data minimization. As much as possible, take minimal data of your patients. Don't store everything, history, geography, physics. No, what you need, only minimal data. Second, take one form and take a consent that you are taking all these data from because tomorrow they should not say, we did not know that my data was gone. Once Data Protection Act comes into picture, a lot of people will start putting false cases against others, telling I didn't know. So if the consent is there, no problem. Take the necessary security measures. Access control, I told you. Now you may tell, sir, you are only telling what to do. How to do, you are not telling. I will tell I will tell, give some time. So third is data security measures. Fourth is access control. Fifth is anonymize the data. So even if your data is leaked, even if it is gone, you don't have to worry because nobody gets to know whose data it is. Blood group is there, details are there, name is not there. What is name? Personally identifiable information. That is only not there. With other data, what can somebody do? So you cannot map it. So we call this as data anonymization, regular training, incident response plan, then retention. You need to keep the data for some time. So till that time, it should be there. Tomorrow, the law enforcement agency asks you, I want the report of that patient. You tell, I don't know where it is. No, you can't say that. So you need to have that data. And once the retention period is done, you need to securely, you have to dispose it. So that is important. Ninth, you need to understand the patient rights. And the 10th one is the compliance monitoring. How to do this? How to do this? For that, you need to know there are different rights that are given to the people in Data Protection Act. What are the rights? Right to access. So the patient can access what data you have stored. Right to rectify. The patient has the option to update or correct their personal data. Right to erase. The patient can say, no, no, I don't want my data. Remove it. That is called as the right to be forgotten, which has come in India. Earlier, it was only there in the GDPR. Now it has come to India with the DPDP. Fourth one, right for data portability. Fifth one, right to information. Sixth is right to object. Seventh is right to restrict processing. And the last one is right to withdraw consent. So many things are there. So what to do? First, I told you, encrypt the data. How to encrypt? Use these tools. VeraCrypt, BitLocker, AXCrypt. Now you may tell, I can't write it down. Don't worry. I will give the PPT so you can see the PPT later. Okay. So VeraCrypt, BitLocker, AXCrypt. With this, what will happen? All the sensitive information of the patients, it will be encrypted. Now, what is encrypted? Encrypted means people who see that cannot make out anything without decrypting. Who can decrypt? Only you can decrypt. How? By putting the password. Now, what will happen if you leak the password? Gone. So don't leak that password. Okay, next one. Consent management. I told you, you have to take the patient's consent before you take their data. How? One, trust or consentium. These are the tools that you can use to obtain, manage, and document the patient consent for data collection and usage. Because a lot of them have this habit, taking data and doing all the scientific study, and patient doesn't even know. Tomorrow patient gets to know, he'll file one case. So this should not happen. Consent management. Third, access control. I told you, attender also same password, chairman also same password. No, no, no. For that, use RSA Secure ID. Best, I also use that RSA Secure ID or IBM Security Guardian. So if you use this, what will happen is you can define roles, what watchman can do, what manager can do, what system admin can do, what chairman can do. Okay. Then data anonymization. Encryption is one. Another, I told you, anonymize. So anonymize, what will happen? Even if the data is leaked, we'll not know which data is whose. So a beautiful anonymizing tool is called as ARX data anonymization tool. ARX data. This is used by all the doctors in the Europe. It is ARX data anonymization tool. They use this. All the data is anonymized. Nothing is there. So nothing will happen to you. You will be protected. Then the SIEM, Security Information and Event Management. Some problem happens. What to do? Nothing. Don't worry. IBM QRadar, ArcSight, Splunk can be used. This is not for individual clinics. This is for hospitals. Next, employee training. Cybersafegirl.com, Know Before, SAN Security, the Cybrary. These are some of the websites where you can go and update your knowledge. Most of these courses are free. So learn. Also attend more seminars by Telplus so that you will see Telplus. They are doing such a wonderful thing. So many doctors. I don't think so anywhere for doctors in our country so far a seminar on data protection has been done. As far as I know, I have not come across. So that shows the proactive measures of this company. How they have done in the Telplus series, the micro labs. Wonderful thing. Next one, 7, incident response and management tools, pager duty. Then data retention. I told you, for so many days you should keep, after that delete it. How? Mention how many days the data should be there. Use Veritas Net Backup. Use Blanco Data Eraser. Use VM. So many days it will be there. After that, gone. So even if somebody asks you give that data, you can tell no, the period is over, the retention period is over, it has gone because we are using this tool. Simple as that. 9. Patient rights management, you can use TrustArc, and the last one is compliance and audit management tools. You can use Magic Stream. Okay, so that is it. So as I've told you, forwarding patient data and all, please don't go to do that because sometimes what happens, one data you want to forward to another doctor, by mistake you put it in a group only, everybody gets to know. So be very careful, because one thing we need to remember is forwarding a message is accepting the message and endorsing the message. Okay, and also we have already I know that you will say that. So you can't see anything. My screen is on, but you will not be able to see anything because I have put something called as a privacy filter. I repeat, privacy filter screen is available for your phones as well as for your laptops. Put it, the person sitting next to you, even if your spouse is sitting next to you, he or she would not be able to see what is happening on your device. To do, because your data is your data, nobody else's. So privacy filter screen should also be put on your device, and for every 20 minutes of screen time, for 20 seconds look 20 feet away. That is what I want to tell. And also, as far as possible, use swipe keypad. Yeah, so that the keyloggers also don't work with that. Keyloggers can capture data when you type, but here when you swipe, they will also not get to know. And because see this is the new problem. Everybody, look at your pinky finger, all of you. Look at your pinky finger holding phone like this, like this. What has happened? Your finger also has become like that, you know. So that is the problem which everybody is facing these days. But it's like a double-edged sword. So advantages are there, disadvantages are there. Any data breach, any point in time, call 1930 National Cybercrime Helpline number, and that is it. If you have any questions, you're most welcome to ask. I hope I have tried to cover whatever possible with regard to this. Let us see if you have any questions. I'll be happy to.
Yeah. Thank you, Dr. Anand Prabhu. It was, as usual, a session which the doctor would have glued upon, because you covered the most important topics. Many times, we don't realize that we get a data, we get a message through WhatsApp. It can be a patient data. How it has to be safely be kept, how long it should be kept, all those things you have covered. And as we move forward, there is one query has come in the question and answer section. Can you suggest any good anti-hack app that has to be in our mobile?
Yeah, if anti-hack apps were there, then I would be jobless, no? So
Mhm.
there are no viruses. So what you could do is please install McAfee or key antivirus that you can use. I personally use Windows Defender. I repeat, Windows Defender for my Windows laptop. I McAfee. Okay, you may also use bot. So there are a lot of apps that you can use. But remember, doctors, it's one. Okay, so it has to be paid. Don't use the free ones. Free ones are very
Yeah.
dangerous. Okay, number one. And number two, just installing it is not enough. You have to regularly update it, because there is something called as virus signatures. So if you don't update the virus signatures, your phone will not know that the something that has come is the latest virus. Assuming, so remember, regularly update your antivirus, regularly update your app, so that whichever loopholes are there, they are plugged appropriately.
Yeah, so thank you. So Dr. Kushbati has asked if this session will be needed in recorded form. Is it possible? Yes, sir. Yes, doctor. You will be getting the feed first. Then, uh, any say
Yeah, see, now what is happening is survey is one big problem. Okay. Now, survey, if it is an anonymous survey, I have no problem. Because if you don't take the patient name and you don't take their PII, personally identifiable information, no problem. But when the survey has got all these details, then if you don't store it properly, if it gets leaked, the pharma company should be ready to shell 250 crores up to. Remember that. So therefore, handle such data. So I've told you very clearly, if that such data you're taking also, encrypt it, anonymize it, so that you are on the safer side.
Right, sir. So the next question is, what about using EMR apps for patient consultation? Electronic medical record apps for patient consultation. What
Yeah.
is your viewpoint?
See, you can use it, but depends upon which, because some use free ones. Now, that free ones
Hmm.
are given to you because they can take your patient data and use it for analysis, data mining and data analysis. So make sure that you are using an authentic, reputed one. And if possible, don't connect that system to the internet, because if you connect it to the internet, it means the data going, chances are they're leaking. So as far as possible, take all these prerequisite methods, which will protect the patient data and also protect you legally.
Yes, sir. So one general question. Post-COVID, there is the concept of telemedicine has gone in a big way, like through WhatsApp or various any other ways the patient consultation is happening. What are the basic guidelines the doctor should follow when they go for this telemedicine? Like
Yeah, first
simple
thing is
ones.
don't use WhatsApp. That is the first thing. Okay, the
Okay.
second thing is, yeah,
But
don't use.
normally they claim it is encrypted, no, sir?
Yeah, I don't, because this is a recorded session. I don't want to talk more on that. But
Hmm.
if I have to tell the honestly, if I have to tell, please use a military grade encryption software, which is Signal. I repeat, Signal. So download
Signal.
Signal, yeah, on your phones and
Hmm.
use it. It's very safe and secure.
Okay, so it is called a signal, sir.
Signal is the name of the app. It's a military
Okay,
grade encrypted app.
signal app. Okay, sir. I'm just sharing it in the webinar chat so all the doctors would be able to go through. Sir, anything else along with that, sir? For telemedicine, whenever the doctor is using.
Yeah, one
Safe.
is that, and the second thing is don't connect to free Wi-Fi wherever you are. So make sure that
Okay.
you're using the proper internet. Third,
Hmm.
make sure that your device that you're using has got a paid antivirus.
Okay. So these are the basic guidelines which they need to follow when they go for this one. Okay, sir. Got it.
Yes.
Yeah. I would request doctors to, if there is any more queries, please type it in the webinar chat. Our expert would be happily to attend to it. Or I mean, that's the one point which we want to ask with the team. We had, meanwhile, sir, we had a great response for your edition, volume one of this program, where you covered up a general topic, need not be on patient data privacy. You covered up many things, which even today there is a queries about where the recording is available. And thanks also, once again, we were able to split it into multiple bytes and share it with the HCPs. It
Lovely,
has become
lovely, sir.
wonderfully accepted. I believe this is the same thing we would be able to do with this session also. And
Yeah.
this is more serious, specific topic covering healthcare professional. Last time it was meant for general public.
Yes, yes.
So that was a great thing, sir. Okay. I believe there are not many queries from doctor sides.
I would also like to thank Sai Kumar ji for
Mm-hmm.
very wonderfully coordinating this, and I'm happy to see Samak Sirish ji also here.
Yeah.
So yeah.
He is sitting in the flight, sir, so unable to take
Oh.
the one. Okay. And then one more question. Is there any possibility of data breach when we attend Zoom meetings?
Yeah, yeah. It can happen. See, not because of Zoom. See, what happens is our computer or our mobile phones, we have one very bad habit. Whenever we install, it asks all the different permissions, contacts, gallery, storage,
Yeah.
microphone, and we give yes, 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 yes to all. So when you've
It
given
is
a
like,
microphone,
it is like signing housing loan agreement with the bank,
without reading
like
all the
without
pages,
reading all the
everywhere.
things. Yeah.
Very nicely said, sir.
Yeah.
So what happens is we go on signing every single page, and the best part is in the end there is a checkbox which says I've read the terms and conditions, and
Yeah.
very proudly we press that. and then we say accept without knowing that we become the product instead of we actually using the product.
Yes.
So what
Yes.
happens is, if there are some malicious apps which has got all these privileges, whatever you're doing on your Zoom platform, whatever we are talking here today, probably they can also take a copy of it and they can use it for anything else.
Yes, sir. Yes, sir. Thank you. Window or we purchase an
Windows systems.
okay. When
Cafe, you may use Casper.
Is it?
Yes.
Got it, sir. Yeah. Any more queries, doctors? Otherwise, on Sunday evening, time first coming here and spend plan trick is how to said it is double-edged sword. The more we get use out of this, more risk is also involved. So I think we would religiously try to follow to minimize it. We can't nullify it, make it zero. So we try to follow it up. It's a great session, sir. Once again, we thank from Microlab side and also Telplus Treats team who have been worked religiously in making this program possible. Soon we will meet up next month with one more interesting topic and take it forward. Thank you once again. Thank you, doctors.
Thank you, Vigneshji, and thank you, sir.